it's a very exciting time to be in surgery. For a long time, we did what we call minimally invasive surgery using some instrumentation that basically didn't have any kind of mechanized attachments to it. It's just directly in the surgeon's hand and went through the abdominal wall inside the belly or other cavities to be able to do surgery. With the advent of the Da Vinci system, we now have the ability to have a lot more fine control of the instruments that we're using, because the platform is actually a robotic system that attaches to the patient. It sounds a little sci-fi to have a robot in surgery, but really what we've done is we've tried to standardize the motions that we use to be able to do procedures so that we can fix things with a lot of precision and also with an improved ability to see. It's kind of the next generation of minimally invasive surgery. It's expanded the services that we can provide to our patients, and to keep them from having to sometimes be admitted to the hospital or have longer hospital stays because of these less invasive techniques. One of the exciting things about the Da Vinci platform is that we have two consoles. I can sit at one and I can have an assistant or a resident sit at the other, and so they can experience the exact same thing that I'm experiencing, and I can show them things, and they can, with graduated level of responsibility, be able to do parts of the procedure so that they can learn how to be the surgeon that we want them to be. This is a really important part of the Veterans Administration, that we do train people to be surgeons for the future. We've really been able to expand the procedures that we can offer here. Now it's really become almost standard of care to do a lot of these procedures with the robot because of what it affords the patient. We've gone from routinely having to admit patients to the hospital for 3 to 5 days to some of those patients being eligible to go home the same day after their operation. And I think that it's pretty obvious that that's a big improvement, but the other things that have changed are the amount of pain that patients experience and the long-term results that they're going to have are at least equivalent, if not better, than the other kinds of procedures that we did before. We just think the sky's the limit here. This is the future of surgery. We're on the cutting edge because we're doing these newer procedures and combined procedures between specialties, but this is really where surgery is going, and we want to be prepared for that, for our ability to serve veterans obviously at the standard of care, but above it if possible.